Just I'm taking one confirmation. Hello, sir. Good morning, everybody. Hope audio, video, everything is okay. Yes, I can see here the students Arti, Avinash, Raghu, Chinky, Ragini. Hope everything is okay, beta. Please inform me in the chat box. Yes, sorry for little technical issues. Now everything is okay. So can we start? Just give me the thumbs up. Just give me the thumbs up. So can we start this rapid revision session, the fast track session? Whatever we studied during that 4 days classes at the Bangalore, we are going to revise all the things again. Okay. Yes, we will not cut the content. Approximately 95% contents will be the same. Okay. Few unnecessary things, few things which are very easy. Okay. We will remove them. Fine. But 95% the same content. So just flow with me. Just flow with the class and you will get the revision of each and everything. Okay. Fine. Yes. Okay. Thank you, Avinash. Thank you, Ragini. So just see, applied anatomy, the physiology part. We did the one beautiful session at the Bangalore Center for the 4 days in detail with lots of the concept, tricks, mnemonics, concepts also with the fun. Okay. So right now we are going to revise the same thing for the our final exam. Okay. So can you recall? During the starting of the session, I told you the few laws. First, the zero law. What is zero law? Break the name and think about it. You have to break the name and think about it. Like I given the example Anna plus Tommy. Anna means to see, Tommy means cutting. Means you have to cut and you have to observe. You have to cut and you have to observe. Cutting and observation is the anatomy. So this was zero law. Okay, because it is a common sense law. This was the common sense law. So remember, dear friends, whenever you are studying in medical science anything, you have to break the name and you have to think. नाम को तोड़ना है और सोचना है. You have to break the name and you have to think. Okay. Now, before starting, I told you the story of the anatomy. Yes, what we are cutting, what we are observing, we are cutting the human dead bodies. That is the cadaver. So cadaver is a god for all of us. Okay. So remember the structure when we are cutting and we are observing, that is the structure, that is the anatomy, and how it is doing its function. The function is the physiology. My body, whatever you are looking, this is the anatomy, and how it is doing the function, that is the physiology. Is it okay? Fine. Now I told you one liner question. The father of the plastic surgery, Shushruta. Don't forget, the father of the Indian surgery, Shushruta. Different countries, they consider the different person as the father of the surgery, but in India, the father of the surgery, Shushruta. One liner question. As well as the father of the plastic surgery across the world, entire world, consider the Shushruta. Okay. Next, I told you about the Hippocrates. What you have to remember? Father of the medicine. Yes, your answer is the Hippocrates. But the father of the medicine in India, you have to remember the Charak. Charak Samhita, Ayurveda, father of the Ayurveda. Ayurveda is the Indian medicine. Answer is the Charak. Okay. And then I told you about the father of the anatomy. Who is the father of the anatomy? Hero of the anatomy, Herophilus. Just one liner question. The father of the anatomy. Yes, your answer is the Herophilus. And then we had seen the father of the modern anatomy. Who is the father of the modern anatomy? Yes, one liner question. Vesalius. Vesalius is considered as the father of the modern anatomy. Yes, he started the anatomy with the new concepts again. World Anesthesia Day is celebrated on the 16th October. And just one day before the World Anesthesia Day, we are celebrating the World Anatomy Day on 15th October. Is it okay? Fine? Clear? This 15th October is the death anniversary of the Vesalius. Okay, sir. Now, I told you the few rules which we given in a funny way, the rules of the CBI agents. Yes, CBI magics. So zero magic or common sense magic, I told you break the name and you have to think. You have to break the name and you have to think. Simple. Then first magic for all the 19 subjects of the MBBS, of the medical science, to know the body, surgery, dissection, about the layers in the our body. And then I told you the second magic. Yes, total 639 muscles are there, and how to know the nerve supply and the muscle. And then third magic, the different joints and the movement. Okay, I given one example. Suppose you are learning in the surgery one topic. What? Congenital hypertrophic pyloric stenosis. Congenital means this disease will occur in children. It is not in the adult. Hypertrophy means increase in the size. Yes, pyloric means part of the stomach, and stenosis means narrowing. So you will see with the name, you can know the many concept. This is the pedia topic, surgery, medicine topic. Break the name and think about it. So if there is the stomach, here is a pylorus. At the pylorus part, sir, there is a hypertrophy. Is it okay? So there is the stenosis, narrowing. So when the children is drinking the milk, feeding anything, the food is not going distal, but it is again coming out. So this is the vomiting. So what is the main feature in the congenital hypertrophic pyloric stenosis? Answer is the vomiting. And when there is a vomiting, the acid will come out. Yes, acid will come out. So in the acid, sir, there is a chloride. So in the body, chloride is less. Chloride is the brother of the sodium. Brother and sodium and chloride both are together. So sodium is also coming out. So sodium is also decreased. Now kidney is compensating the sodium because sodium is very important ion. So kidney is compensating. Okay. So what is happening? Kidney is compensating the sodium, but instead the sodium excreting the potassium. So there is a hypokalemia. So with the basic law, yes, you can easily understand, break the name, think about it, and you can get the patient, the one children is coming to you with the vomiting, and on examination he is having the hyponatremia, hypokalemia, as well as hypochloremia. This is the case of the CHPS, congenital hypertrophic pyloric stenosis. Are you getting? What you have to do? You have to break the name and you have to think. Okay. Now, after this basic law, I told you the first magic for all intramuscular spaces for the surgery, medicine, ops, gynae, this all the things. So I given one example. Suppose we are cutting the body part. Suppose we are cutting the arm in transverse way. So what are the different layers? Yes, the different layers are skin, and after the skin there is a superficial fascia, and after the superficial fascia you are getting the deep fascia, and then the muscles. Muscles are attached with the bones. Is it okay? Fine. So what are the different layers in the body? Skin, superficial fascia, deep fascia, muscles, and the bone. 5 layers in the body. And Hollywood, Bollywood, Tollywood integration. We will not only revise the concept, tricks, mnemonics, but also all the jokes, all the songs. So that at that time, I told you the skin, superficial fascia, deep fascia, muscles, and the bones. These are the different layers of the body. But yes, we did the diagrammatic presentation and one funny song also. Yes, the song. You know this song? Hollywood, Bollywood, Tollywood. कलियों का चमन तब बनता है, थोड़ा शीशा होता है, थोड़े घुंघरू होते हैं, थोड़े हीरे होते हैं, थोड़े मोती होते हैं. Do you know? Okay, so just enjoy that one. So this real song is coming from the CBI anatomy. Yes, you all are the CBI agent. Yes, so the CBI song, एनाटॉमी में डाइसेक्शन होता है, पहले स्किन होती है, फिर फेशिया होती है, फिर मसल होते हैं, फिर बोन होता है। हाँ हाँ हाँ, don't forget the background music. Okay, you can forget the anatomy, you can forget the layers, but how can you forget this song? So don't forget this one. And yes, make the class interactive. If you are enjoying, just comment yes 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 in the comment box. And look, there is a, at the down there is an emoji session, so there is the emoji for the heart. Just give the heart, just give me the heart. Make the session interactive. Yes, dear students, make the session interactive. Yes, so I'm getting the heart, Komal Viz. So dear students, can you see? Interactive session we have to make. ऐसा नहीं लगना चाहिए. It should not be there that I am teaching the camera and you have not to feel that you are learning from the mobile, but you have to feel that I am sitting in front of you, you are sitting in front of me, and we are connecting together, we are learning. Okay, so for that the chat box is very important. You have to comment at the chat box. Okay, so what I told you, different layers in the body. Here is the English version. Anatomy shapes the body piece by piece. First comes the bone, then muscle release. Next is the fascia layer so tight. Finally, the skin to finish the sight. हिंदी वर्जन, एनाटॉमी में बदन तब बनता है, थोड़ा बोन लगता है, थोड़ा मसल लगता है, फिर फेशिया लगते हैं, फिर स्किन लगता है। हाँ हाँ हाँ, आर यू गेटिंग? Okay, sir. Then I taught you that in each intermuscular space, yes, sir, in each intermuscular space, sir, this is the space which is in between the muscle. So this is the intermuscular space. Are you getting? Many intermuscular spaces are there, like triangles of the neck, like axilla, like cubital fossa, like anatomical front box. Do you remember? We are taking the drug abusing substance, we are putting here, rubbing it, snuffing. So it is in our anatomy. Just extend the thumb, and look at the base. Yes, do it. Fine. You will put and you will rub, and then snuffing is done at this part. So what is the name? Anatomical snuff box. Very important. Okay. Yes, you will be asked the question about the femoral triangle. You will be asked the question about the popliteal fossa. So every time, what are the different boundaries? You have to think. So this is the intermuscular space. So we are sitting in the hall. What are the boundaries? Roof, floor. Suppose it is entry side, entry wall. That is the posterior side, posterior wall. Suppose this is the medial side, medial wall. Suppose that is the lateral side, lateral wall. Are you getting? So these all are the boundary, and whatever the structures inside it, these are the content. Okay. So can you see, if we are standing here, so what are the structures making the roof? Skin, superficial fascia, deep fascia. Always the roof are formed by the, now this is the rule, skin, superficial fascia, deep fascia. This is the rule. Floor is formed by muscles and the bone. Every fossa space in surgery, medicine, obstetrics, whatever subject, anatomy, the floor will be formed by the muscles and the bones. And what are the boundaries? Sir, muscles are the boundaries. Non-contractile part of the muscle is known as tendon. So tendon will also participate in the boundary. Okay, what are the content? Always the content is vein, then artery, then nerve. Also the lymph node. You can remember the formula V A N. So the formula is VN. This is known as a neurovascular bundle. Neuro means neuron, vascular means vessel. Vein plus artery is known as a vessel. Is it okay? Fine. So can I ask the question? For this all, we created the same diagrammatic presentation at that time. Same image. So can I ask the question? What are the structures making the roof of the triangles of the neck? Skin, superficial fascia, deep fascia. What are the structures making the roof of the, suppose cubital fossa? Again, skin, superficial fascia, deep fascia. What are the structures making the roof of the anatomical snub? Very important. Skin, superficial fascia, deep fascia. Can I ask the question? What are the structures making the roof of the femoral triangle popliteal fossa? Again, skin, superficial fascia, deep fascia. Every time your answer is the skin, superficial fascia, deep fascia. Are you getting? Fine. Always the boundaries, muscles, always the roof by the muscle and the bone, and always the contents are vein, artery, nerve, also the lymph node. Vein plus artery is equal to vessel, and nerve is known as a neuro. So what is a neurovascular bundle? Sir, vein, artery, nerve bundle is a neurovascular bundle. Also, there is a lymph node. Is it okay? Fine. Now, after this all, we had seen the, yes, these all the things are written. After that, we had seen the second magic for the 639 muscles and their nerve supply. Okay, that was the Hilton law. What was the Hilton law? Sir, look here. This is the our great holy country, India. So Ganga river is on the north side. Krishna, Kaveri, Godavari is on the south side. So it is very simple that Ganga will supply to the north states. Krishna, Kaveri, Godavari will supply to the south states. Simple. Ganga will never supply to the south, and Krishna, Kaveri, Godavari, it will never supply to the north state. Simple. Means the river of a particular area will supply all the structures, all the land of that area. Is it okay? In the similar way, remember, yes, if any nerve is flowing in a particular part, that will supply all the muscles of that part. So in simple way, again, in English and in Hindi, in English, a river flows both wide and bright, feeding the cities day and night. Hindi version, जो नदी जहां रहती है, जहां बहती है, उस एरिया को सप्लाई करती है. Are you getting? So apply this one in the body. So can you see this three-dimensional anatomy? Yes. Lal full, Neela full, anatomy, beautiful. Yes, the beautiful three-dimensional anatomy. Do you remember? Fine. Yes. Look here, sir. This is the body part. Sir, this is the arm portion. So yes, upper limb. So this is the arm entry compartment, and there's a posterior compartment, right? Forearm, again entry compartment, and here is the posterior compartment, and this is the hand portion. Okay, so in the arm entry compartment, sir, this is the biceps. Sir, when you're cutting the biceps, can you see this is the brachialis? When you're cutting this brachialis, can you see this is the another muscle, that is a coracobrachialis? What is the nerve supply? So during the dissection, we will see, sir, here is the musculocutaneous nerve. So musculocutaneous nerve will supply all the muscles of that area. जो नर्व जहां रहती है, जहां बहती है, उन सारे स्ट्रक्चर को सप्लाई करती है. सर, द नर्व इन दिस एंट्री कंपार्टमेंट, दैट इज द मस्कुलोक्यूटेस नर्व. So that musculoskeletal nerve will supply all the muscles of that area. What are the muscles here? B, B, C. B for biceps, B for brachialis, C for coracobrachialis. So can you tell me biceps is supplied by musculocutaneous, brachialis supplied by musculocutaneous, coracobrachialis supplied by musculocutaneous. MCQ, 3 MCQs important. Now you will see, sir, on the back side, sir, there is which muscle? Triceps. On the back side, which muscle? Triceps. Here is a tricep. Can you see there is a radial group? One muscle depression is seen here, na? Here is one muscle depression. Radial nerve is here. जो नर्व जहां रहती है, जहां बहती है, उसे सप्लाई करती है. So radial nerve is here. So triceps supplied which nerve? Radial nerve. Simple. And in the similar way, in this forearm, on the anterside, he is the median nerve. Which nerve is here? At the middle line, median nerve. So every muscle on this front of the forearm supplied by median nerve. Khatam, Tata, bye bye, gaya. हे प्रभु, हे हरिराम, हे प्रेमानंद, हे जगन्नाथ, गामछा ही खुल गया मेरा. Are you getting? Very simple. No need to mug up the anatomy. It is very simple. Just apply the law. जो नर्व जहां रहती है, जहां बहती है, उसे सप्लाई करती है. The nerve of the particular area will supply all the muscles of that area. Are you getting? Which nerve is here? Median nerve. So the median will supply all the muscles. Any muscle, we'll see. And on the back side, there is a radial nerve again. Sir, here is the radial nerve, here is the radial nerve. So any muscle on the back of the forearm supplied by radial nerve. Complete. No need to mug up. Okay? And in the similar way, in the lower limb, we will see one by one. Sir, this is the thigh. This is the lower limb. Thigh. Entry compartment, medial compartment, posterior compartment. So in the entry compartment, yes, how many compartments? Anterior, medial, posterior. On the entry compartment, which nerve? Femoral nerve. So any muscle on the front, it will be supplied by femoral nerve. रट लो बेटा, यहीं से क्वेश्चन आता है, इतना याद रखना है. All the muscles in the entry compartment will be supplied by the femoral nerve. Complete. Any muscle, we'll see later, na? And this is the medial side. On the medial side, you will see, sir, this is one foramen. Sir, this is the obturator foramen. What is the name of this foramen? So this is the obturator foramen. So which nerve is coming from here? Sir, obturator nerve. So obturator nerve is running on the medial side. Here is which nerve? Obturator nerve. So any muscle on the medial side supplied by obturator nerve. Khatam, Tata, bye bye, gaya. Only these things you have to remember. Simple law. Always, whenever we are studying, we are looking for the big things, great things. No, know the basic things, apply it, solve the MCQs, do the mistakes again and again, do the analysis, improve it. Again, solve the MCQ, again do the analysis, again do mistake, again improve. So there's a multiple revision cycle, okay? And the nerve on the back of the thigh, sir, the nerve on the back of the thigh, the nerve on the back of the thigh. Sir, the nerve is the sciatic nerve. Which nerve is here? Sciatic nerve. So any muscle on the back side supplied by sciatic nerve. Okay. So these are the things later I will teach you. Sir, this is the leg. In the anterior compartment, deep peroneal nerve. So every muscle in the anterior compartment of the leg supplied with the deep peroneal nerve. Sir, the nerve of the lateral side, that is the superficial peroneal nerve. So every muscle on the lateral side supplied with the superficial peroneal nerve, and the nerve supply on the posterior compartment. Sir, answer is the tibial nerve. We will see. Yes, deep peroneal nerve, superficial peroneal nerve, and here's a tibial nerve. We will do the revision for the 5 times, 10 times. So don't worry. Okay, always do the revision. Always do the revision. Okay, fine. Okay, sir. So after this, all the basic concept, this second magic, we are coming to the third magic. Okay, everyone. Hope you all are getting the points. Yes, Arati, Ragini, Avinash, do the comments. Give the heart, thumbs up. If you will not do the comment, if you all will sleep, I will also sleep. Okay. Yes. Okay. So Pushpita, Ragini, thank you. Thank you. You all are here. Aarti is here. Okay. So now come to this further. Where muscle goes, there movement flows. So try to understand, sir. This is the one bone. This is another bone. Junction between two bone known as a joint. And here is a muscle. So if any muscle is crossing the joint from the superior side, and when this will contract, they will pull the bone on the superior side. So they will cause superior movement. Superior muscle, superior movement. And if any muscle is crossing the joint inferior side, so when they will pull, they will cause inferior movement. Okay. Where muscle goes, there movement flows. Jidhar muscle, udhar movement. Are you getting? Yes. So if any muscle is anteriorly, it will cause anterior movement, posteriorly, posterior movement, medially, medial movement, laterally, lateral movement. So I told you that stay tuned with my Insta, where you will get this all the things in a very interesting way. Okay. So here you will see the many interesting videos. Okay. Also nowadays in the exam, the video based questions started. So yes, at that time I had shown you the Insta videos. This one, I think audio will not be there. Okay. So such kind of the short clips are there. Na? Try to understand. If muscle is crossing the joint anteriorly, when it will contract, it will cause anterior pulling, anterior movement. If any muscle is crossing the joint posteriorly, so when that muscle will contract, it will cause posterior movement. Simple. If any muscle is crossing the joint laterally, when it will contract, it will cause lateral movement. If any muscle is crossing the joint medially, so when it will contract, it will cause medial movement. Simple. Is it okay? So such kind of simplified videos will be there. So don't forget to save them. Okay, sir. So after this all, we are looking for the anatomical terminology. Okay. So at that time, I told you, don't know 10,000 types of the kick. Don't know the 10,000 types of the topics. Know the few topics and do the practice for the 10,000 times. It will give the better result, and also definitely no excuse with the your test. Okay. So at that time, we had seen the anatomical position. What is the anatomical position? Just one quick revision. Body is erect, eyes looking forward, hands hanging by the side, and palm is directed forward. Thumb is where laterally. Both fit together and toes are forward. So this is known as the anatomical position. No question is going to ask. But remember, in surgery, medicine, PDF, whenever you are describing any surgery, you have to think in this one. So what is anatomical position? Just simply this one. Body is erect, eyes looking forward, Hands are not in this way, not that way. Hand by the side, palm is right forward, thumb is laterally, and both fit together. Toes are forward. This is the anatomical position. Yes, everything was written. And what is supine position? Sir, patient is lying on the back. Patient is lying on the back. Okay, yes. Yes, Vijaya, good morning, better. Fine. Please inform your all the friends. Slowly the number of the students are increasing. I think they are not aware. If not aware, just call them, just inform them. Class has been started. Okay. So this position is used for the abdominal surgery, thoracic surgery. Yes. Now the prone position. Can you see this is the prone position? Patient is lying on the chest and abdomen. So this is useful for the back surgery, gluteal surgery. Simple. Prone position. Now this is the lithotomy position. Yes, this is the very, very important position, lithotomy. So patient is lying on the supine position and both fit together. Okay. They are resting on the foot support strap. So the perineum area is open. What is the perineum? Area between two thigh is known as perineum. Area between two thigh is known as perineum. So at this area, sir, there is a urethra, vagina, and anal canal opening. Sir, there is the urethra, vagina, and anal canal opening. Getting the point? Okay. So these are the things which you have to remember. Fine. Now try to understand further. Sir, there is the yes. So this position is important for the baby delivery from the vagina, anal canal cancer, rectum surgery. Suppose you have to do the surgery for the urinary bladder urethra, then this lithotomy position is used. In obs-gynae, this is the most important position. Don't forget this position. This is the lithotomy. Okay. So whenever there is a lithotomy term in your brain, it should be clear. Now, what is a lithotomy? Okay. Next, lateral decubitus. What is the lateral decubitus? Sir, patient is lying on the side. We are sleeping in this way. So this lateral side view, lateral sleeping is the lateral decubitus. Okay. So now I'm going to tell you the different terminology. Everything is written here. Na? Look here. What is the terminology? This is anatomical position. So first, what is mid-sagittal plane? So the plane which is dividing the body into the right and left two equal halves. Mid-sagittal plane. This is also known as a median plane. Yes. If any sword is coming and it is cutting my body exactly into the two equal halves, right and left. That is a median or mid-sagittal plane. How many median plane are possible? Only one. No other plane is there. Only one median plane. And now what is the sagittal? This is also known as the mid-sagittal or median. Now what is the sagittal plane? Any plane which is dividing the body parallel to this mid-sagittal, parallel to the mid-sagittal. So this is the mid-sagittal and parallel to it, that is the sagittal. How many sagittal planes are possible? 1, 2, 3, 4, 5, 6, 7, infinite. Sagittal plane, infinite. So these all are the sagittal plane. Now, what is the transverse plane? The plane which is parallel to the ground. That is the horizontal plane, transverse plane. So whenever you are looking the transverse section, don't forget this one. Okay, beta? Next, come to here. Sir, what is the your frontal plane? This is the question asked in your exam. Frontal plane. Okay. What is the frontal plane? The plane which divides the body into the front and the back. Front and the back. That is known as the frontal plane. This is also known as the coronal plane. This is known as the coronal plane. Why I taught you radiology? If you don't know this terminology, you cannot deal with the surgery, medicine, organic surgery, radio, any subject. So in the radiology, you will see the transverse MRI. Can you see this is a transverse view? I will teach you later. Coronal view. So you can see the head is above, neck is below. So this is the coronal view, frontal view. And this is the sagittal. Can you see? This is the nose, mouth, occipital area. So this is what? This is this kind of the section. This kind of the section. Are you getting? Agree? Yes, very good, Vijaya. Yes, please keep do comment at the comment box. Fine. Now see the other term. Sir, any point which is near to the head, known as superior, known as the cranial. Both are same thing. Near to the head, cranial. Always you have to think in the anatomical position. And what is the caudal? Sir, the point which is away from the head, that is known as the caudal. Is it okay? Next, what is the median? Any point which is exactly at the midline, that is the median. These every points they are at the midline, so this is the median. But if any point is close to the midline, not at the midline, close to the midline, that is known as the medial lobe. Are you getting what is the medial? No, I mean medial lobe. And what is the lateral? The point which is away from the midline, that is the lateral. Now, what is the proximal and distal? So this is the trunk. Any point which is close to the trunk, that is the proximal. P for proximal, P for pass mein. And any point which is away from the trunk, that is a distal. D for distal, D for dur mein. So don't get confusion in terminology. Are you getting? P for proximal, P for pass mein, D for distal, D for dur mein. Always you have to look the trunk. What is the trunk? Chest and abdomen is the trunk. So humerus is proximal bone or distal bone? Proximal. Radius are there proximal or distal? Distal. Femur is proximal or distal bone? Femur, proximal. You have to look from the trunk. TV and fibula, they are distal. Okay. So hope you are getting the point. Now come to the next. Yes, this is a lateral decubitus. Now we are sleeping on the side. So this is a lateral decubitus. It is useful in the ear surgery. Next, I guess everything I told. Now look, sir, what is the anterior? Any point which is front, always you have to think in the anatomical position. That is known as the anterior, also known as the ventral. And what is the posterior? Any point which is on the back side, that is known as the posterior or dorsal. Is it okay? Clear? Next, the movement. Yes, see, what is the flexion? Decrease in angle of any joint is known as flexion. What is the extension? Increase in angle of any joint, extension. Do with me, what is the flexion? Decrease in angle, increase in angle, extension. Can you tell me, what is this? Flexion or extension? Flexion. Decrease in angle. And what is this? Extension. Yes. This is, suppose at the bottom, this is a knee joint. So what is this? Flexion. What is this? Extension. Are you getting? Decrease in angle, flexion, increase in angle, extension. Now, abduction and adduction. Abduction and adduction. Away from the midline, abduction. Ab means away. Adduction. Aiding towards the body, adduction. When you are aiding, जब aid कर तो adduction, and if you are doing away, abduction. So any muscle who is causing adduction, adductor. If long, longus, adductor longus. Are you getting? If any muscle is small, then adductor brevis. Are you getting the nomenclature? The zero law, the basic law. Break the name, think about it. Abductor. If any muscle is causing abduction, abductor. If this muscle is causing movement at the thumb, pollicis, abductor pollicis. Long muscle, longus. Small muscle, brevis. Simple. Abductor pollicis longus, abductor pollicis brevis. Is it okay? Simple, very simple. Now, in this same way, rotation. Medial side rotation, medial rotation. Lateral side rotation, lateral rotation. Simple. No need to mug up. Medial side rotation, medial rotation. Lateral side rotation, lateral rotation. Simple. Okay. Next, come to this other points. Sir, look here. Combination of the different movement is known as the circumduction. So combination of the different movement. Yes. Jasprit Bumrah is doing the bowling. Yes. So there is a flexion and there is an extension. There is an abduction and there is an adduction. So whenever this combination of the movement is known as the circumduction. Circular movement is the circumduction. Circular movement is known as a circumduction. Are you getting? Now supination, pronation. When the palm is moving superiorly, supination. When the palm is going downside, pronation. Supination, pronation. Are you getting? So don't forget this law. Hollywood, Bollywood, Tollywood, all are arising from the anatomy. And yes, all the famous person, they are the CBI agent. Yes, their dancing style is coming from the anatomy. So you know, Amitabh Bachchan uncle, yes, you know, Kajrare, Kajrare, te kare kare naina. So Amitabh Bachchan uncle is dancing in this way. So actually, this is movement coming from the anatomy. Supination, pronation, supination, pronation, supination, pronation. He is the CBI agent. He attended the CBI anatomy classes and got the inspiration from the supination, pronation and danced with this one. Okay. Hope you are getting the point. If you all are understanding, just give me the heart. Just give me the heart. Agree, better? Okay. Now look, after that all we had seen about the parts of the bone. So we are going to talk about the parts of the bone. Yes. Thank you. Thank you. Budiga Pogu. Thank you, better. Thank you. Thank you so much. Yes. Dilip, thank you. Mir, thank you. Yes. So this is now it is the interactive class. Yes. Pratishtha, thank you. Mir, Sivarudra, Pushpita, Ragini. Thank you, everybody. Thank you. So now we are going to talk about the parts of the bone. Very important. Do you remember? Any long bone is having the four parts. What are the four parts? Yes, just revise. This is the revision class. Sir, ends of the bone known as the epiphysis. Epi means end. Sir, the shaft is known as the diaphysis. And the part which is in between the epiphysis and diaphysis, that is known as the metaphysis. But sir, in the children, sir, between the metaphysis and the epiphysis, there is a cartilage. Blue color is cartilage. That cartilage is known as the growth plate cartilage. What is the name? Growth plate cartilage. Sir, this is the primary cartilage joint. MCQ. It is which type of joint? Primary cartilage joint. So four parts of the any bone. What are the four parts? Epiphysis, diaphysis, in between the metaphysis, and this is a growth plate cartilage. These are found in the young bone, children bone, not in the adult. Now, your medicine and physiology integration. This growth plate of the cartilage, it is under the control of the growth hormone. Growth hormone, if it is more, growth hormone is causing, yes, growth in the bone. So there is an elongation in the, yes, length of the bone. There is an elongation in the length of the bone. So we are getting increase in the height. Yes, we are children, we are having the small height, but as we are growing, this growth hormone is causing cell division in this growth plate of the cartilage. So there is an increase in the height. Is it okay, everybody? Fine. So the physiology and the medicine. If there is more growth hormone in adult, then it is resulting into the acromegaly. How can you remember? Sir, A for adult, A for acromegaly. So what is happening in the acromegaly? Sir, in the acromegaly, there is an increased growth hormone. There is an increased growth hormone. Is it okay? But in the children, yes, growth hormone is not more. So it is resulting into gigantism. Is it okay, beta? In the children, it is resulting into a gigantism. Yes, more growth hormone in the children. Don't say acromegaly. You have to remember gigantism. Giant, giant. Yes, A for acromegaly, A for adult. Growth hormone excess. Yes, it is important for the physiology and medicine. But if the growth hormone is less in the children, then it is a dwarfism. Dwarf, little height. Okay, Bona, dwarfism. Okay, so don't forget for the your physiology and the medicine with the anatomy integration. Now, in adult, sir, that cartilage is getting ossified. In the adult, this all the bones are getting fused. Okay, so only the two bone, only the two part, epiphysis and the shaft. In children, how many parts? In adult, how many parts? Are you getting? So in the adult, only the epiphysis, two epiphysis, but diaphysis is one. Okay, so only two part, epiphysis and diaphysis, two epiphysis and one diaphysis. Is it okay? After that, all I told you the classification of the bone. Yes, it is not too much important. Just one quick reading according to the shape: long bone, short bone, flat bone, irregular bone, pneumatic bone, small bone, accessory bone. Long bone, typical long bone, like the radius, like the ulna, like the femur. Miniature long bone, yes, which are small. So these all are the different kind of the bones. Clear, everybody? Sir, there are the short bone, like the carpal bone. Yes, there is the flat bone, skull bone, irregular bone, vertebra and the hip bone, they are not having the proper shape. Pneumatic bone, which are having the air. So who are the pneumatic bone? Frontal and the maxilla. Yes, accessory bone, we will see. Yes, small bone, seed like bone, patella. Fine. And then these are not too much important. So yes, regional classification I will tell you. And the structure, this is also not important. So yes, it is the revision class. Not all the things are important. So now look, MCQs. Total bones in the body, 206. In the newborn, 300. So these bones are getting ossified. So one quick revision. Look here, one quick revision. Yes. How many skull bones are there? 28. Yes, look here. How many bones in the skull? Sir, total number 28. Okay. But hyoid bone is how many hyoid bone? Only one. Only one hyoid bone is here. Okay. How many thoracic bone? Sir, one sternum and 12 pairs of the ribs. Means 24. Vertebral column? Sir, vertebral 26. So look here. One quick revision of the skeletal system. Sir, again, Red flower, blue flower, anatomy, cool shower. Okay. So just observe here, sir. Here you can see the skull. 28 bones are here in the skull. And this single bone, what hyoid? This is the hyoid. Are you getting? Fine. And then we will see one by one. Sir, there is the axial. Axial skeletal means which are located at the central part. So you will see, so these are the axial skeletal. So in the axial skeletal, so this is the vertebral column. So this is the vertebral column. No? So this is the vertebral column. Fine. And sir, axial skeletal, the sternum, one sternum and 12 pairs of the ribs. Fine. Okay, sir. So again, catch these things, sir. This is one very important question which are asked in your nursing exam. One of the most commonly asked question in nursing exams. So don't forget. Yes, how many vertebra in embryo? Cervical vertebra 7, thoracic vertebra 12, lumbar vertebra 5, sacral vertebra 5, coccygeal vertebra 4 in embryo, total 33. But in adult, sir, 7, 12, 5, 1, 1. So total 26. Are you getting? Because 5 sacrum they are fusing and making 1. 4 coccygeal bones they are fusing and making 1. So now in adult 26 bones in the vertebral column. But if they are asking about the spinal now, then remember not the C7 but C8 spinal nodes. T12 thoracic, 5 lumbar, 5 sacral and 1 coccygeal. Don't forget this formula, very important. No excuse. How many spinal nodes are there? 31 pair. How many cranial nodes are there? 12 pairs. Cranial nodes are 12 pairs. Spinal nodes are 31 pairs. Very important, no? Fine. Next. Sir, pectoral girdle, 4 bone. How? 1 scapula, 2 scapula, 1 clavicle, 2 clavicle. So total 4 pectoral girdle bone. Upper limb total 60. So what are the different bones? Pelvic girdle 2 and lower limb 60 bone. So total in the adult 206. So one quick revision for the your bones. So again, look here, sir, upper limb bones. So we will see one by one, step by step. Hello everyone. Yes. Yes, Ragini, please remove this annotated file part. Yes, thank you, thank you. Can you see what are the bone? This is the clavicle, also known as the beauty bone. One clavicle on one side. This is the shoulder blade. Yes, that is the long bone, humerus, funny bone, humerus. Sir, this is the forearm bone, radius and the ulna. And here you can see the carpal bone. Can you see? She looks too pretty. Try to catch her. Scaphoid, lunate, triquetral, pisiform, trapezium, trapezoid, capitate, hamate. Now the 1, 2, 3, 4, 5 metacarpal, and these are the phalanges. In the thumb 2 and remaining all are having the 3 phalanges. Total 14 phalanges are there. Okay. Okay, just one knowledge, no need to mug up this all the things. Fine. Now lower limb. How many hip bone? Only one. Now this is the femur. Sir, how many femur bone? Yes, longest and strongest bone of the body. Answer is the femur, only one. And then you will see the tibia and the fibula. This is seed-like bone, patella. Sesamoid bone, the patella. Are you getting? This is seed-like bone, sesamoid bone. Sir, this is the patella. Are you getting? MCQ, na? Largest sesamoid bone of the body, patella. Sir, this is a kneecap. Kneecap. And this is the patella. Don't forget, it is the largest seed-like bone. And then foot bone. Very important. Foot bone. Definitely one question from the foot. Okay. So this is the largest foot bone, calcaneum. And above the calcaneum, this is the talus. In front of the talus, this is the navicular bone. Very important. Which is articulating with the medial, intermediate, lateral cuneiforms. This 1, 2, 3 cuneiforms, they are articulating with the first, second, third metatarsal. And this is the, yes, cube-shaped bone, cuboid bone, which is articulating with the fourth and fifth metatarsal, and these are the phalanges. Simple. Hope you all are getting the point. Okay. Now look, after this all, we are looking about the cartilages. After the bone, we are looking the cartilages. Okay. So try to catch three types of the cartilages: hyaline cartilage, elastic cartilage, and the fibrocartilage. Okay. Hyaline cartilage is made by the hyaluronic acid. That's why hyaline cartilage. Elastic cartilage is having the elastin fiber. Yes. And the fibrocartilage is having the collagen. Is it okay? Clear? Hyaline cartilage, sir, it is blue in color. Appearance, sir, shiny or translucent. Fibers are not seen. Elasticity, sir, it is flexible. Perichondral cells, these are maximal. And location, these are present at the articulating surface of the bone. While the elastic cartilage, they are yellow in appearance, they are opaque. Elastic fiber is present and most flexible. 3E are here. These are present in the 3E, where E for elastin cartilage, E for ear pinna, E for epiglottis, E for eustachian tube. Okay. Now the fibrocartilage. So you will see the fibrocartilage, yes, it is having the white opaque collagen bundles are present. Yes, it is firm and very strong. It is present at the strength point. Okay. So look here, it is present in the intervertebral disc. In summary, just remember hyaline cartilage, it is present at the articulating surface. E for elastic cartilage, it is present at the E. Here is the elasticity ear pinna. Yes, fibrocartilage, they are present at the collagen site, like the intervertebral disc. Is it okay? Now come to the next. Look for next. Hope everything is okay. Yes. Now, after this, we had seen about the joint. Joint is very important topic. One question sure from the joint topic. So look, this joint is very important, na? Sir, junction between two bones known as joint. The non-veg formula is the FCS, FUX. What life does with us, that is a FUX. FCS. Are you getting? F for fibrous cartilage, C for cartilage joint, fibrous joint, cartilage joint, and S for synovial joint. Now, the fibrous joint, if two bones in between them, fibrous connective tissue, that is a fibrous joint. If there is a cartilage joint, and if there is a fluid, synovial joint. Okay. Fibrous joint, no movement. Fine. This is also syn orthosis. Syn means fusion. Whenever you are looking the term syn means fusion. Ortho means joint. So when the two bones are joining together properly, then it is a syn orthosis. So can you see the three types of the fibrous joint? Your funny formula is Sa Su G. S for suture, S for syndesmosis, G for comphosis. Yes, two types of the cartilage joint, primary and secondary. And then we will see the synovial joint later, that is also the diorthosis. So other name of this joint, synorthosis, fibrous. Amphi, cartilage. Amphi means both. Little movement is possible, little movement is not possible. And diorthosis, here always the two bones are separate, so free movement. Yes, synorthosis, no movement. Amphiorthosis, little movement. And diorthosis, free movement. Is it okay? Okay, yes. Thank you, Vijaya. Thank you. Bodiga, Pogu, thank you, beta. Now come to the next, one by one. Do you remember this joint? Sir, plain, squamous, serrated, dentate, wedge and groove. One question sure from the joint. Okay, fine. Look here. When the two articulating surfaces are parallel, plane. When articulating surface, they are oblique, squamous. When the articulating surface are zigzag, serrated. When the articulating surface, they are tooth-like, dentate. And when the one bone is wedge shape, another is groove shape. So this is a wedge and groove. Is it okay? Clear, everyone? Clear? So another way to remember, yes, do the hand in this way. Plain suture, squamous suture, zigzag, serrated suture. Now do dented. Strongest suture, dented suture, strongest. Okay. And now make wedge and make groove, wedge and groove suture. It is very important. It is very important. Na? Any exam, you are facing for the nursing, you are facing for the FMG, you are facing for the INICT NEET PG. How? Look here. हाथ कंगन को आरसी क्या, पढ़े लिखे को फारसी क्या. How? Sir, every exam. So just catch. Fine. Can you see the questions? Any exam, na? Right now I'm just giving the one example, FMG, recent exam, January, General Anatomy. Can you see this one? Suture. Yes, one joint. So they ask this question. Always I'm teaching this one. Fine. So I'm going to show you the three-dimensional orientation. Fine. So always they are asking. Yes, always they are asking the such kind of the question. Again, sir, plain suture, squamous suture, serrated suture, zigzag, then dented, strongest suture, and then wedge and groove suture. Again, with the 3D anatomy. Look here, observe here. Sir, plain suture. Can you see? Interpalatine, plain suture. It is plain. S for suture, S for skull. Sutures are present in the skull. Intranasal, that is also plain. This was the question which had been asked in the recent exam. Yes, temporal bone, parietal bone. So this is the temporoparietal suture. That is a temporoparietal. This is the squamous suture. It is squamous suture. And then look here. This is zigzag surface. Can you see? Frontal bone, parietal bone. Interparietal. This is zigzag, 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 zigzag. Yet this is bragma, zigzag. And can you see this is the lambda, lambda, ossifondal. This is a dented suture, strongest suture, dented suture. And where is the wedge and groove? Can you see? This is the nose. That is the nose. So here is a single purple color bone, vomer, ENT. That is a vomer. So when you're looking this same bone from the back side, can you see the purple color bone? This is a vomer. So look here, the very, very beautiful anatomy. Yes, lal fool, nila fool anatomy, beautiful. Can you see? This purple color is making the wedge, and this blue color bone is making the yes. You guys blue color bone is making the wedge, and this purple color bone is the groove. So wedge and groove. This is the wedge. It is the groove. Are you getting? Wedge and groove. This is the sphenoid bone. That is a vomer bone. So sphenoid and vomer. Here is a wedge and groove. Just for one information. Is it okay? Now, after this all, come to this synodesmosis. Okay? When the two bones are joining together with the help of the ligament, then it is synodesmosis. Okay? Between the radius and ulna, between the tibia and the fibula. Sir, there is the synodesmosis. Now, gomphosis, very easy. In the gum, gomphosis. Yes, in the gums, gomphosis. So teeth and the gum, there is a fibrous suture, that is a gomphosis. Simple. Next, cartilaginous joint. Again important. So two bones, they are articulating with the help of the cartilage. Then it's cartilaginous. Now here is the, yes, ossification. So when the cartilage is getting ossified, so later no movement, because it is getting ossified. So later no movement. So this is known as the primary cartilaginous joint, also synchondrosis. Syn means fusion, chondro means cartilage. Are you getting the nomenclature? Synchondrosis. So this is the cartilage where the ossification. So this is a primary cartilage joint. It is found between epiphysis and diaphysis. Very important. So between the epiphysis and diaphysis, which joint is there? Sir, primary cartilaginous synchondrosis. And when? Sir, cartilage is present, but there is a no ossification, but fibrous tissue is present. It is not getting ossified. So partial movement is possible. So this is known as symphysis. This is known as the symphysis. Are you getting? Synchondrosis, symphysis. That is the primary. This is the secondary. Your formula is the MIS. M for manubriosternal joint, I for intervertebral disc, S for symphysis pubis. So this symphysis pubis is present at the middle line of the body. It is showing the partial movement. It is showing the partial movement. Is it okay? Clear? Now look here, the ball and socket joint. Sir, we are looking for the ball and socket joint. Okay. So, sir, there is a one bone is there, which is having the ball-like surface, and another is having the socket. Sir, there is a synovial fluid, so this is synovial joint. To prevent the synovial leakage, sir, there is a fibrous capsule. Are you getting? So, there is a ball and socket joint. Fine. So, remember, these are multi-axial. They are causing the movement at every axis. Flexion, extension, one axis. Abduction, adduction, one more axis. Medial rotation, lateral rotation. This is the third axis. Yes. This is the male surface and it is the female surface. Is it okay? Male surface is inserted into the female surface. Okay, sir. Now, ellipsoid joint. Sir, it is also ball and socket like, but it is biaxial, only two axes. Same, no? Same, but two axes. So there is the two axes like wrist joint. How can you remember the ellipsoid joint? E for ellipsoid, just push it, W. So W for wrist joint. Also, you can say radiocarpal and just push it. So it is M, metacarpophalangeal, metatarsophalangeal. Look here, the wrist. This is the ellipsoid. Can you see? Flexion, extension, abduction, adduction. No medial lateral. You will say, sir, this is the medial. No, this is the pronation, this is supination, which is in between radius and ulna. Tightly hold the radius and ulna. Now rotate the wrist. Your radius ulna must not be rotated. No, it is not possible. If you are rotating, sir, this is a medial rotation and your radius ulna is moving, means it is not the wrist movement, it is a radio ulnar movement. So only two axes, now flexion, extension, abduction, adduction. So this is not the ball and socket, it is the ellipsoid. In similar way, metacarpophalangeal. So can you see flexion, extension, abduction, adduction? You cannot do the medial rotation, you cannot do the lateral rotation. No? Two axes, ellipsoid. Now hinge joint, uniaxial joint. Are you getting? Multi-axial, biaxial, uniaxial. Everyone getting the point? Clear? Only one axis. Like hinge joint. Your formula is the IEA. We are opening the door and we are asking the guest, IEA, padhariye. Are you getting? IEA, IEA. Door-like movement, hinge joint. I for interphalangeal, E for elbow, F for ankle. Can you see? Interphalangeal, flexion, extension. No other movement, hinge joint. Elbow, flexion, extension. No other movement. And then ankle. Yes, there is a dorsiflexion, plantar flexion. No other movement. Hinge joint. Okay. Now, after this all, plane synovial. When the two articular surfaces they are plane and they will glide together. That is the planes. It is between the vertebra and the ribs, costovertebral. Now saddle. Can you see saddle? Yes. When the articulating surface they are S-shaped. Same bone having the male surface, same bone is having the female surface. So this is saddle. No excuse. Sir, first carpometacarpal bone. First carpal bone and metacarpal bone. This is the classical saddle joint. Now condylar joint. Sir, when there is a one bone is having the condyle-like surface. Globular condyle-like surface, that is a condylar joint. Are you getting? So knee joint and temporomandibular joint. Don't forget. Knee joint is having the medial condyle, lateral condyle, medial condyle, lateral condyle. So these are the condylar joint. Like the knee joint, like the temporomandibular joint, these all are the classical example of the, yes, you can say. Clear? Now, come to the next, pivot joint. Sir, this is central axis around which another bone is present and it is rotating. The classical example is the C1 and C2. Sir, there is the atlas vertebra and the axis vertebra. Atlantoaxial. So catch this one again. Sir, this is a classical example. Again, yes. 20 rupees Pepsi, anatomy sexy. How? Look here. Sir, this one. Skull bone. Sir, this is the first cervical vertebra, atlas. And you can observe it is alternately the second cervical vertebra, axis, atlas, axis. This is second cervical vertebra, axis. So you can observe atlas and axis. So within the odontoid process of the axis, the atlas is rotating. So there is a right, left, right, left, right, left. Rotatory movement is there. So such kind of the rotation joint is the pivot joint. Pivot joint means rotation joint. Are you getting? Yes. your funny way to remember, Priyanka Chopra से बहुत प्यार हुआ. So these are the different kind of the synovial joint. P for plain synovial, C for condylar, S for saddle, E for ellipsoid, B for ball and socket, P for pivot, H for hinge. So this is a funny way to remember. Yes, everything is given in your workbook. We had seen at that time in detail. Right now we are doing the revision. All the joints in this page, and here the formula. Priyanka Chopra se bahut pyar hua. We shared the file to you. Okay, fine. Okay, sir. So these are the important joints of the body. Right, sir. Now we are going to talk about the muscles. Any muscle, biceps, triceps, lower limb muscle, upper limb muscle, whatever. Okay. Yes, Shivaruddha, this is the same workbook which we did last time, na? Which we did last time, PDF. Okay. The same workbook. Okay. I shared that workbook at this Telegram group last time. Or you all the batchmates, you will have this one. So you can join my Telegram group where every day the anatomy quiz is also there. Okay. And if you go on the back, it was at that time when we did the, you can go at the files, Bangalore class. You will be able to find, yes, here, Bangalore Anatomy Physiology. So last file you have to look. Okay, the 23, 22, 20, 20 April. So that one, that file, that 23. This is the final file. Again, I'm resharing for all of you. So we are revising the same content. Okay, if you are new or any new student is there, I'm again sharing the Telegram link. Okay. Again, re-forwarding in the group. Here, I re-forwarded this one. Yes, stay tuned. And every day, the 10 MCQs are there. Every day, 10 MCQs of the anatomy, you have to click there. How much time? Hardly 10 minutes every day. Okay, make it true. Okay, can we continue? Okay, you got the link. Very good, very good. Okay, fine. Okay, so now let's continue with the muscle. So look here, sir, any muscle, biceps, triceps, abdominal muscle, upper limb muscle, lower limb muscle, head neck muscle, any muscle. Generally, they are having the two part, contractile part known as belly, non-contractile part known as tendon. Okay, tendon, they are flat. Flat tendon, they are known as aponeurosis. Okay, and belly, sir, the contractile part of the muscle is known as the belly. Now, every muscle is having the two part and two end. One end is origin, another end is insertion. Origin is mobile end and insertion is fixed end. Suppose here is my biceps, biceps. Yes, I'm not having the biceps. But suppose, yes, it is my biceps. So whenever I am contracting, so my biceps, this is fixed, but this is more mobile. It is less mobile, it is more mobile. So this is the origin and here is the insertion. Are you getting? Okay. So mobile end, remember, sorry, it is ऑपोजिट यहाँ पर बेटा ये गलत है इसको हम करेक्ट कर रहे हैं ना सर ओरिजिन इज फिक्स इसको करेक्ट करो एंड द इंसर्शन इज मोबाइल one correction for all of you insertion is mobile insertion is mobile yes again this is the my biceps I'm moving this one so this is fixed so fixed end is origin and this is more mobile so this is the insertion any part suppose here is the flexor carpi ulnaris so this is the movement so this is the fixed end origin and here is the mobile end so that is the insertion now the muscles are having the connection with the neuron so that is a neuromuscular junction so look here the neuromuscular junction so now this is the physiology part so try to catch sir this is the one neuron meeting with the muscle sir suppose this is the muscle part we are using the electron microscope okay so current in the neuron it will be transmitted into the muscle how look here sir action potential is the current which is causing stimulation of the nerve so this is the action potential suppose the action potential for this condition is the 1 millivolt suppose so as the action potential is coming at the end of the neuron calcium ion is coming inside mcq which ion shows influx answer is calcium mcq calcium is showing influx is it okay now as the calcium is moving inside then what is happening sir this is the neurotransmitter vesicle which is filled with the neurotransmitter suppose it is your yes you can say acetylcholine suppose it is acetylcholine so as the calcium is coming the synaptic vesicle is coming close and it is meeting with the membrane so now acetylcholine is released now this acetylcholine is going to the receptor what is the receptor जो रिसीव करे वो रिसेप्टर है जो लाइगेट करे वो लाइगेंड है जो रिसीव करता है which is receiving that is a receptor so this is the receptor which is ligating this molecule so this particular molecule is ligand and this blue color structure is the receptor who is ligand in this condition acetylcholine and who is the receptor the acetylcholine receptor now as both are meeting together one small current is generated as both are meeting together sir there is the influx of the sodium and this sodium is the ion it is current so when the sodium is coming inside there's a small current is generated suppose it is 0.1 millivolt suppose it is very small current 0.1 millivolt okay sir but there is not one sodium there is not only one receptor but there are the n number of the receptor n number of the ligand so all are generating the small 0.1 0.1 0.1 0.1 0.1 current छोटा current generator 0.1 millivolt now these all are fusing together and they are making one big current that is the action potential okay so the action potential which was here in the neuron now it is generated into the muscle yes this entire part is the muscle so action potential finally jumped into the muscle and action potential will cause action in the muscle so muscle will cause contraction is it okay clear this action potential will cause contraction now try to understand sir in that situation always the muscle will contract so what is happening god created one enzyme what is the name acetylcholine ester ase means breaking ase means breaking like lipase maltase okay collagenase जहां एज आया वहां तोड़ देना एज इज कॉजिंग ब्रेकडाउन सो दिस एंजाइम इज कॉजिंग breakdown of the acetylcholine. So this is the acetylcholine esterase. So it is causing breakdown of the acetylcholine. So acetyl coenzyme plus choline is broken down there. Is it okay? Fine. So remember this one. Now see, we will see in the pharmacology in medicine one drug, anticholinesterase. This anticholinesterase, it will inhibit the acetylcholine esterase. It will inhibit the acetylcholine esterase. Is it okay? So if it is inhibited, then it will continuously cause action potential generation. We will see later. But right now, look, one very important question, myasthenia gravis. Okay? ये आप लोग एग्जाम में हमेशा आता है. Okay? So remember, the myasthenia gravis is very, very important topic. Break the name. Maya means muscle. Asthenia means weakness. Gravis, autoimmune condition, that is gravis. Graves disease, autoimmune condition. So generally, gravis is indicating the autoimmune disease. This disease was, Amitabh Bachchan was suffered from the myasthenia gravis. So now look, what is the cause? Idiopathic or unknown cause? Yes, Amitabh Bachchan got autoimmune reaction during the Coolie movie, one movie in which Amitabh Bachchan was hidden by the one villain. So due to unknown reason, there was the stimulation of the autoimmune reaction within the body. So in that part, autoantibody was formed against the acetylcholine receptor. Don't forget MCQ. Autoantibodies formed against the acetylcholine receptor. So now the acetylcholine receptor complex is not formed. So action potential is not generated. See, in this disease, in the myasthenia gravis, this is the acetylcholine receptor. So antibodies, they are destroying this acetylcholine receptor. No acetylcholine receptor is there. So no action potential, no end plate potential. So no action potential. So no contraction of the muscle. If muscle is not contracting, then what you will say? Muscle is weak. Are you getting? So that is myasthenia gravis. So this is the no action potential, no muscle contraction. So this is muscle weakness. So weakness of the muscle that even patient is not able to elevate the eyelid. Okay. Yes. So the patient is presenting with the drooping eyelid. He is not having so much power, so much weakness of the muscle that patient is not able to open the eye. So he is presenting with the ptosis. Patient is not having the power. So patient is having the open mouth. Are you getting? He's not able to even close the mouth. So this is what? Yes, open mouth feature. Means very lethargic appearance of the patient. And diaphragm is the muscle. You know diaphragm is the muscle. So when the diaphragm is involved, patient is not able to do the respiration. So there is a respiratory failure and happy birthday of the patient. Means death of the patient. Are you getting? So in the myasthenia gravis, there is a still death of the patient can occur. Okay, sir. Now what is the treatment? So it is an autoimmune disease. Any autoimmune disease in the world, what is your treatment? PAC pack. Otherwise, you can have a CAP cap. Any autoimmune disease, yes, you have to give the prednisolone, which is the steroid. You have to give the azathioprine. You have to give the cyclosporine. Mug up this one for the medicine and pharma. Any autoimmune disease, you must have to give the steroid prednisolone. Other drugs which can be given, they are the azathioprine, cyclosporine. Is it okay? Next, second treatment you can do antibody removal. How can you do the antibody removal? Plasmapheresis. See, whenever pheresis word, pheresis means filtration, छानना. आप ब्लड को डायलिसिस मशीन में ले जाते हो और पूरे ब्लड को छानते हो. You are filtering the blood. That is a plasmapheresis. So in myasthenia gravis, what you will do? Plasmapheresis. Yes. In the thymus, the lymphocyte antibodies, they are getting mature. So cut the thymus, remove it. Ectomy, thymectomy. Whenever Tommy means cutting, but whenever there is ectomy, means cut and remove. Tommy means cutting. Ectomy means cut and remove. But whenever there is a stomy, means opening. Are you getting? I am putting the example. Gastrostomy means opening in the stomach. Gastrotomy means cutting of the stomach. And gastrectomy, cut and remove the stomach. Is it okay? Is it okay? Clear? Now, anticholinesterase, neostigmine, you know, water soluble, and physostigmine, lipid soluble. Is it okay? Clear? So try to understand. If any patient is having no receptor, means it is no generation of the action potential. So what you will do? Just inhibit this enzyme. So physostigmine, neostigmine, they are anticholinesterase. They will inhibit it. Okay. So there is the binding of these two. So action potential is continuously generated. So action potential is continuously generated. So there is a contraction of the muscle. Are you getting? In myasthenia gravis, what is your treatment? Sir, physostigmine, neostigmine, which are anticholinesterase, which will cause inhibition of this enzyme. So these two will show the love. ये क्या है? ये गर्लफ्रेंड है. ये क्या है? ये बॉयफ्रेंड है. ओके? और ये कौन है? विलन है. ओके? विलन इज डिस्ट्रॉइंग देम. फाइन. तो अब आप क्या करोगे? हीरो का दोस्त, बॉयफ्रेंड का दोस्त, physostigmine, neostigmine, they are coming and they are inhibiting the villain. So the heroine and the hero, they are loving together and they are causing the action potential generation. Are you getting? Don't forget, it is very important. Pharma, medicine, physiology, integration. Okay? Don't forget. That is a physostigmine, neostigmine. Okay? Organophosphorus. Organophosphorus are also the same. The organophosphorus, they will inhibit this one. So they will cause continuous activity. We will see. Okay. So these are the points which you have to remember. So now this is the same thing which I taught. Okay. So here we are going to take a break, then we'll continue this one. So one little break for the 10 minutes. Okay. Thank you, everybody. Please ask if any doubt. Please ask if any doubt. Tea break. Okay. So after 10 minutes, we are again joining together. Thank you. Hello everyone. Yes, so we are going to continue the session. Please inform your friends again. Yes, hello everyone. Please give it a thumbs up that audio, video, everything is okay. Can we continue? Yes. So Pratishtha is saying all okay. Fine. Okay. Thank you. So catch this fact, sir. Suppose we are taking the example of one muscle. We are doing dissection. We are removing any muscle, like the typical example, biceps. We are cutting and removing the biceps. Okay. So when you are cutting and removing the biceps and you're using the microscope, so you're taking out one small fibril. Are you getting? So one small fiber. So when you will see the one small fiber of the muscle, one small fiber of the muscle, you will see the dark area, the light area, the dark area, the light area. Is it okay? The dark area, yes, it is known as the A band. The light area is known as the I band. So this is the formula, na? Dark A, dark area, A band. Physiology, light area, I band. Okay. Now can you see these fibers are also again having the small unit. So we are cutting it and we are looking inside the electron microscope. So can you see? This is the light area, this is the dark area, this is the light area, this is the dark area, this is the light area. But within the dark area, again one small light area is seen. This is the dark area. But one small light area is seen. This is known as the H zone. And in the same way, this is the light area. But within the light area, one dark line is present. This is known as a Z line. Now, the most important fact, sir, the area between two Z line is known as sarcomere. The area between two Z line is known as sarcomere. So, functional unit of the skeletal muscle, sarcomere, MCQ, very basic question. Smallest contractile unit of the skeletal muscle, sarcomere. Sarcomere is the smallest unit of the contraction. No sarcomere, no contraction. Okay. Again, we are using the electron microscope. So can you see? This is the light area. This is the light area. In between the light area, there is a dark area. Is it okay? Fine. Now catch again. Sir, in this light area, there is one dark line. In this light area, there is a dark line. The area between these two dark lines, that is a Z line, this is a sarcomere. So this is the one sarcomere. So you can see within it, there is a dark band, A band. You know, dark band is the A band. Light band is the I band. Yes. Light band is the I band. In this I band, actin protein is there, and this is thin. And this is the dark band. In the dark band, there is a light area that is a Z band. So remember, this portion is overlapping. This is the light band, this is a dark band. Are you getting? This is a light band, but this is a dark band. Light band, dark band. So these are overlapping. But can you see this portion is non-overlapping? Are you getting? So this non-overlapping part is the H band. Okay, sir. No, sir, we are getting confusion. Just remember, this is Z line. In between the two Z line, this is a sarcomere. Now this is a relaxed condition of the muscle. But when you will see the, yes, contracted stage. Okay. Again check. Again check. The area between two Z line is known as sarcomere. This is a dark or light band. Dark. Okay. So this dark band is having the one protein that is a myosin protein. Dark means mota. M for mota, M for myosin. So this is the thin band which is made by the actin. और ये relaxed phase है बेटा, ये relaxed phase. But when this contraction means shortening. So when this contraction, the Z line will come here, and these areas are coming up to this part. So this is shortening. पहले कितना था? Yes, earlier it was, but now this is small. So many sarcomeres. So all the sarcomeres are showing shortening. So there is the contraction of the muscle. So this is the relaxed phase. And can you see? This is the your yes same contractile phase. ये थोड़ा और अंदर आएगा ना contractile phase. Okay. So in the summary, catch here. ये देखो बेटा. Summary. Anyone you have to make the friend, either the dark band or the light band. Dark band, it is also known as the A band. Because it is dark, that's why it is thick. जो डार्क होता है वो मोटा होता है, जो मोटा होता है उसमें मायोसिन होता है. So your mnemonic is ATM. Anytime money, ATM. Okay. ATM. A for A band, also known as the thick band. It is having which protein? Myosin protein. Okay. Because it is thick. So it is dark or light? Dark. जो मोटा होगा वो dark होगा, जो पतला होगा वो light होगा. Is it okay? ATM. So this is the formula. ATM. I told you. तो बेटा light band उल्टा. I band. It is thick or thin? Thin. Myosin or actin? Actin. Eta. What? Anyhow, एक को याद रखो. Just remember this ATM. Agree everyone? Clear? Now, yes, we had seen this one. Now look, contractile muscle protein. Just remember this one, na? Actin and myosin. Okay, fine. Only this one. Now come to this one. Intramuscular injection. Yes, it is important for the clinical. So we are using the many types of the injection. No? We are having the oral route, drug delivery system, pharma. We are having the intramuscular, intravenous, sometimes the intraarterial. So right now we are talking about the intramuscular because we are reading the muscular. So technique to deliver the vaccine, it is given deep into the muscle. Almost all drugs can be given. Common practice in the modern medicine. Okay, sir. Sir, where you will give the intramuscular when the patient is not taking the oral route, when you are not able to give the intravenous injection, when you are not able to give the subcutaneous, then you will give intramuscular. Okay. So what is the benefit of the intramuscular injection? Where we are giving the intramuscular? Deltoid, sometimes in the triceps, yes, in the gluteus medius, thigh, vastus lateralis. So it is having the fast absorption due to the high blood supply in the muscle, and it is holding high volume of the medicine. Okay. Next, muscle involved. Sir, there is the delta shape muscle, deltoid. Sir, vastus lateralis in thigh and the gluteus medius muscle. Only 3 muscles. MCQ, very important. Sometimes triceps, other muscles are also there. No? Now, look here, deltoid. So you are giving the injection in the deltoid in this way. So yes, this is the R deltoid area. Here, which nerve is there? Axillary nerve. So never give the injection in this axillary nerve. This is a very important question. Otherwise, deltoid will get paralysis. Atrophy will be there. Always avoid the nerve injury. Okay. So you have to feel the acromion process. Here is the acromion process. Now 2 finger below, you have to give the injection at the center of this V. You can feel the V. उसकी बीच में देना है. Again, whatever I'm telling you, sir, most common site of the vaccination, muscle mass is less. So any drug you can give here, which is having the dose less than 1 ml. Yes, remember, always any injection you are giving here less than 1 ml. Like the BCG 0.5, but that is subcutaneous. No? You cannot give the more than 1 ml. No? How you can locate? Yes, feel the acromion process. 2 finger below, at bottom of the V or S. So this is the V-shaped area at the center. Injection given at the center of the V. Okay, complete. Which nerve can be injured? Axillary nerve can be injured at this site. Next. vastus lateralis. How you will give the injection in the vastus lateralis? Yes, look here. Sir, this is thigh. Here is the vastus lateralis muscle, you know. Sir, there is a vastus medialis, vastus intermedius, vastus lateralis. So here is a vastus medialis, there is a vastus lateralis, and here is a vastus intermedius. So the best is vastus lateralis. Such kind of the drug which are given by the patient to himself. Okay, अब कोई इंजेक्शन होता है बेटा इंसुलिन, रोज रोज कहाँ जाएगा पेशेंट? So you will train the patient, take the insulin injection in the thigh, he will self medicate. In deltoid he cannot apply, in gluteal region he cannot apply, but this is very easy. Okay, also the insulin injection given in the abdomen part. Okay, so this is a distal 1/3, this is the middle 1/3, this is the proximal 1/3 of the thigh. So in the middle 1/3 of the thigh on the lateral side, because the femoral nerve is on the medial side now, on the front side, on the medial side obturator nerve, but here is a no nerve. Okay, fine. So this is the vastus lateralis. This is the vastus lateralis. Next, gluteus medius. So you know very well, you're giving the injection in the gluteal area. Fine. How you will do? See, this is the anterior abdominal wall. This is the posterior side. This is the hip bone. So here you will see one bony prominence, anterior superior iliac spine. In short way, we are seeing the ASIS, ASIS. This is the iliac crest. Okay. And here is a femur. So what you will do? You will do this one. No? Index finger over the anterosuppleal spine, the middle finger towards the iliac crest, and this pad of the your thenar area. So it is over the greater trochanter. So there is one V-shaped area. So you'll give the injection in between this V area. 3 point के बीच में रखना है ना, anterosuppleal spine, iliac crest, and the greater trochanter. This is the site you will give the injection. Which muscle? Remember gluteus medius. Which muscle? Gluteus medius. Don't say the gluteus maximus. Okay. Sir, it is safest site for the adult and in the children more than 7 months. When the children is less than 7 months, then where you will give? Deltoid or thigh. Thigh is better, no? Because in the children, thigh is very thick. But gluteal area, they are not developed in the children because they are not walking. Deep situated, no vein artery nerve is getting damaged, least associated with the side effect. So less side effect is here. So it is preferred site, na? Locating the site, I told you how to locate. Next. Yes, this is the method. Needle size in the injection. Yes, depending on the manufacturer, age, size of the person, volume, and the type of the medication. Needle length, yes, long enough. Neither too much long, otherwise it will pierce to the bone. Neither too much short, that it is not reaching to the muscle. Okay, so it can reach up to the muscle without damaging nerve and vessels. Generally, 1 inch to the 1.5 inch for adult and small for the child. So this is your question. What is the normal length of the needle? Answer is the 1 inch to 1.5 inch. And what is thickness? 20 gauge thickness. This is the normal, no? 1 inch is equal to how many centimeter? 2.5. Is it okay? Okay, sir. Now, what are the drawback of the injection? सोचो कल तुमको इंजेक्शन लगने वाला है, क्या लगेगा? एंजाइटी, टेंशन हो जाता है साला, अरे यार इंजेक्शन लगवाने जाना है. Okay, tingling. See, you are doing this one and injection is coming. So before the injection, you feel tingling. Oh my god, oh my god, oh my god. Are you getting? So this tingling sensor, psychological. Okay, and severe pain at the injection. So whenever you are getting injection, there is inflammation. So rubor, tumor, dolor, calor, functionally, sir. Yes. Don't forget the inflammation. Inflammation means itis. Two types: acute inflammation and chronic inflammation. Acute means sudden and severe, immediate inflammation, that is acute, and long-term infection, that is a chronic. Is it okay? So remember this one. Sir, there is the rubor, tumor, dolor, calor, functionalism. Redness, then swelling, then pain, then there is a heat, and there is a loss of function. Is it okay? So there is a prolonged bleeding, drainage at the site of the infection, and allergic reaction. What to do to minimize discomfort? Okay. So you will apply ice or topical numbing cream. मलहम लगाते हैं, ठीक है. Yes, you have to clean the site with the alcohol. Spirit लगाते हैं. Let the dry alcohol. Yes, remember, you are applying the alcohol spirit. Then you have to make it dry, na. You will not make dry. This is the medicine. This is the your anesthesia, other clinical thing, na. If you will not dry, then there is the chances of the more and more infection, stinging sensation. वहां पर पिन चुभे जैसा लगेगा ना. Okay. Yes. Now you will take the vial and you will rub in between the hand. जो इंजेक्शन लगाना कांच का वायल, उसको ऐसे लेकर करोगे. Why? To warm the vial, because vial is kept in the fridge. और बेटा उसका टेम्परेचर कम होता है ना. ठंडी ठंडी चीज को लगाओगे ना और दर्द ज्यादा देगा. इफ यू आर यूजिंग the less temperature part, then it will cause more pain. So what, before injection, take the vial and do this one, so that the temperature of the medicine will equal to the 37 degrees Celsius. Okay. Needed for the administering vaccine or medication. कहां पर लगाओगे? Anterolateral aspect of the thigh. This is the front of the thigh, anterior and lateral. Okay. When the age is less than 7 months, not the 12 month, less than 7 months. Okay. In terms of injection site, if clean in less than 7 months, do not use alcohol and swab. If in the little baby it is soiled, clean with soap and water. Remember, never use the spirit in the newborn baby. Why? Their skin is very sensitive. एक बार अगर ऐसा करके लगा दिया ना, तहलका मचा देगा और बहुत रोएगा, बहुत रोएगा. एकदम बोलते ना, चिनमिनाएगा. Okay, because their skin is very sensitive. So doctor only says don't apply any cream, don't apply any kind of thing in the newborn baby. Only coconut oil, even not the mustard oil. सरसों का तेल भी नहीं लगाना, सरसों का तेल तेज होता है ना. So that's why in newborn baby less than 7 months, if his skin is clean, don't use the alcohol swab. And if it is soiled, just clean with soap and water. Okay. In infant, same thing. In the gluteal area, which nerve can be damaged? Sciatic nerve. In deltoid area, which nerve can be damaged? Axon. Okay. In the thigh area, the femoral nerve, the obturator nerve. So to avoid, go for the lateral side. Is it okay? Fine, everyone. Getting the point? Okay. Okay, sir. Now, these are the different size. You will see these things in the clinical. ये clinical का part है बेटा, है ना. So now we are focusing again for the anatomy and physiology part. Again, deltoid, which nerve? Axillary nerve. Gluteal region, which nerve? Sciatic nerve. Vastus laterally, which nerve? Femoral nerve. These are getting damaged in case of the injection at this particular area. Now we are going to look for the respiratory system. Fine. So let's start this respiratory system. Sir, we have to see the nasal cavity. Then this is the oral cavity. Here is the larynx. Larynx is nothing. It is the upper part of the trachea. But upper part of the esophagus is known as the pharynx. Pharynx is having the part nasopharynx. Okay. Sorry, nasopharynx, behind the oral cavity, oropharynx, behind the larynx, laryngopharynx. So this wide portion behind the trachea, the upper part of the esophagus, this is the pharynx. Pharynx is having the three part. What? Nasopharynx, oropharynx, laryngopharynx. नाक के पीछे nasopharynx. Okay. माउथ के पीछे oropharynx, larynx के पीछे laryngopharynx. Complete. Is it okay? Now the air is reaching from the nasal cavity to the nasopharynx to the, yes, you can say the oropharynx. Then it is reaching to the larynx, laryngopharynx, then larynx, then trachea. Then it is reaching to the right and left side, and then it is reaching to the lung portions. Is it okay? Clear? Fine. So these are the things which you have to remember. Fine, just look at this part. Clear? Now look for the next. Now we are looking for the respiration. What is the respiration? Simple, exchange of the gases. Sir, they are the two process. What are the two process? External respiration, internal respiration. External respiration, gas exchange between blood and alveoli is known as external respiration. And internal respiration, gas exchange between blood and tissue. Try to understand. This is the our trachea and this is the lung alveoli. So we are breathing. Oxygen is coming inside. Now oxygen is reaching to the blood supply. Now oxygen is reaching to the tissue. So lung alveoli to the blood supply. This is known as external respiration. And from the blood to the tissue, it is known as the internal respiration. Is it okay? Clear, everyone? Next. Sir, components of the respiratory system. Two components. Yes, okay. Thank you. Thank you, Akshata Roshni. Sir, you can see there are the two categories. Upper respiratory tract and another is the lower respiratory tract. Lower respiratory tract. What are the parts in the upper respiratory tract? Nose, pharynx. Okay. And what are the lower respiratory tract? Larynx and below. So larynx, trachea, bronchi, lungs. Are you getting? Upper respiratory tract infection. Only the nose and the pharynx infection, that is the, yes, upper respiratory tract infection. And what is the lower respiratory tract infection? From the larynx, laryngitis, tracheitis, bronchitis, even the pneumonitis. That is a lower respiratory tract infection. Is it okay? Next. Sir, physiological classification. Okay. So upper conduction part and lower conduction part. Fine. So here no gases exchange, but here gases exchange occurs, which is also known as the respiratory unit. बेटा जहां पर gases exchange होता है उसको क्या बोलते हैं? Respiratory unit. So this is the only conducting part and it is the gases exchange part, respiratory unit. So where no gases exchange, nose, pharynx, larynx, trachea, bronchi, bronchiole, terminal bronchiole, no gases exchange. But after it, respiratory bronchiole, alveolar duct, okay, yes, alveolar sac and the antrum, these all are the site for the gases exchange. Is it okay? Clear? So this is the your trachea part. Okay. Yes, Akshata sir, if you don't mind, please send your telegram link. Hello भाई, जो बच्चों को नहीं मिला टेलीग्राम लिंक, you can stay tuned here. Yes. Okay. Done. Okay. So now come to the next. Sir, we are talking about the trachea. So there's a trachea. Trachea is reaching to the bifurcation site. This bifurcation site is known as a carina. Now it is dividing the primary bronchus. Sir, it will go to the lung. So this primary bronchus, they are principal bronchus. Primary bronchus are also known as the principal bronchus. Now in each lung, Sir, they are the lobes. So the primary bronchus is dividing into 1, 2, 3. Okay, these are the secondary bronchus. So in the right lung, how many lobe? 1, 2, 3, 3 lobe. So 3 secondary bronchus are present. Is it okay? So these secondary are also the lobar bronchus because they're supplying the lobes. That's why lobar. Is it okay? In the left lung, how many lobes? 2. So in the left side, only 2 secondary bronchus. Only 2 secondary bronchus. Also, this trachea is having the C-shaped cartilage. Yes, see, in the R neck, when you do the transversection, on the backside vertebra, in front of the vertebra, esophagus, then on the front trachea. So there is a formula VOT. Feel the neck. Feel the neck. On the backside vertebra. Yes, vertebra. On the front side, if you press, you will get cough. You will get a problem with the breathing. So this is a trachea, na? This is a trachea. If you compress, oh, problem with the breathing. And upper part of the trachea, larynx. This is the larynx. This is the larynx. So vertebra is behind, trachea is on the front, and in between them, who is sandwiched? Esophagus, which you cannot feel, no? So don't forget this formula VOT. V for vertebra, O for T for. So they are in sequence. They are in sequence. Is it okay? Clear, beta? Is it okay? So this trachea is having the C-shaped cartilage. Okay, and on the back side, sir, there is one muscle. This is the trachealis muscle. So when the food is reaching into the esophagus, this trachealis muscle will cause, it will provide the space. Okay. Yes, Akshata, you have to scan there and you have to join there. Nothing else, no? Fine. So that is what? That is the, yes, trachealis muscle. Okay. Now again, whatever I taught you, it is given here again. Sir, this is the trachea, esophagus. So you can see this is C-shaped cartilage, MCQ. This C-shaped cartilage is made by the which cartilage? Answer is hyaline. It is made by the hyaline cartilage. And just behind it, there is the esophagus. So when there is the, yes, esophagus contraction relaxation, this trachealis muscle will give space. This trachealis muscle is having the beta 2 receptor pharmacology. And this beta 2 receptor, it will cause relaxation. So in the pharma, in the medicine, you will give the beta 2 agonist like the salbutamol. Yes, in pharma, you will see it will cause increase in the cyclic AMP. So it will cause muscle relaxation. Are you getting? This trachealis muscle is having the beta 2 receptor. You are giving the beta 2 agonist. So this is causing the increase in cyclic AMP. So it is causing the bronchodilation. It is causing the bronchodilation. So yes, it is used for the treatment of the asthma. Fine. Which is the type of the COPD, chronic obstructive pulmonary disease. Okay. Now, clinical. Whenever you are learning any clinical about any structure or viscera, first you have to use itis, bronchitis. Okay, means rubor, tumor, dolor, calor, functionalisa. Are you getting? So this is bronchitis. Bronchitis is one of the diseases within the COPD. What are the 4 diseases in the COPD? Asthma, emphysema, chronic bronchitis, and bronchiectasis. 4 diseases. Okay. Now look here, the asthma. What is asthma? Sir, in this, what is the bronchiectasis? Whenever you're looking ectasis, ectasia means dilatation. Bronchiectasis, telangiectasis, lymphangiectasis. Whenever ectasis or ectasia means dilatation. So dilatation of the bronchus means the dilatation of the bronchus, bronchiectasis. What is the asthma? Sir, this is the type of the COPD in which diurnal and seasonal variations are seen. Diurnal, दिन रात का. Yes, दिन में आदमी कम खांसता है, रात को खूब खांसता है. Seasonal variation. According to the season, गर्मी में खांसी नहीं आती, ठंड में खांसी आती है. In summer season, no coughing, but in cold season, there is a coughing. Yes, so this is the asthma. Sir, in the asthma, there is a bronchoconstriction, wheezing, and hypersecretion. Okay. And now tracheostomy. I told you this one. Tomy means cutting. Ectomy means cut and remove. and stomy means opening within the trachea. Is it okay? Hmm? Hmm? Okay. Now, after this, we are looking for the pleura, pleuritis, pleural effusion. Okay. Yes. Envelope of the lung, which is lined by the mesothelium, is known as the pleura. So, what are the parts? Sir, this is the diagrammatic presentation. I think we had drawn. Just see, na pleura. You can see this image. Okay. Catch. Sir, right lung, left lung. In the right lung, how many lobe? Upper lobe, middle lobe, lower lobe. And in the left lung, two lobe. Sir, here's the cardiac notch. Is it okay? So the covering around the lung is known as pleura. Sir, this pleura is having the four parts. Yeah, two parts. Outside layer, parietal pleura. Inside part, visceral pleura. And in between them, there's a fluid that is known as the, yes, pleural fluid. Is it okay? Pleural fluid. If due to any cause, this fluid is getting increased, then it is known as a pleural effusion or pleurisy, clinical. What is a pleural effusion? Yes, accumulation of the fluid in between the parietal pleura and the visceral pleura. Is it okay? Simple. Now, what is the mediastinum? Sir, space between the two lungs is known as mediastinum. Complete. Space between the two lungs. Also, you can say space between the two pleura is known as mediastinum. Okay. Here, heart and other structures are located. So, in the clinical, you will see the mediastinitis. So, inflammation of this space is known as mediastinitis. Okay. Okay. Also, look for this. Sir, right lung, left lung. Which side of the lung is more commonly infected? Which lung is infected, right or left? Right. Why? Because the trachea, then carina, then primary bronchus. So this primary bronchus is comparatively straight, but this secondary is oblique. So infection is more commonly seen in the right, not in the left. Now which lobe? Upper lobe, middle lobe, lower lobe, basal lobe, basal. Why? Due to the gravity. Yes, due to the gravity, and it is in a straight way. Both are same. Pleuritis, pleurisy. Okay, pleuritis is the inflammation. Pleurisy and pleural infusion, they are same. Okay, is it okay? Clear? हेलो. हाँ, मैं थोड़ा 10 मिनट लगेगा सर, है ना? यानी कितने कितने देर में? आधे घंटे ना? हाँ, वो आधे घंटा बेस्ट है, ठीक है. Is it clear, everybody? See, itis means inflammation. Pleuritis is the inflammation. When the pleural fluid is increased, there is a pleural effusion, and pleural effusion and pleurisy are same. Pleuritis is different. Pleurisy and pleural effusion, they are same. Okay, Savita. Fine. Okay, sir. Now come to the next. The pleura. I told you parietal and the visceral. Now this parietal pleura is having the four part. What are the four part? This part here, it is near the neck. So this is the cervical pleura. So this portion is near the rib. So this outer part is known as the costal pleura. Sir, here is the mediastinum. So this medial side is known as the mediastinal pleura. And here is the diaphragm. So this portion is known as the diaphragmatic pleura. Is it okay? Pleura is having the two parts, parietal and visceral. Now the parietal pleura is having the cervical, costal, mediastinal, and diaphragmatic. And the fluid between the two pleura is known as pleural fluid. Okay. So if there is excessive inflammation, sir, its fluid is increased. So you will inject the injection and you will remove the fluid. This process is known as thoracocentesis. Also known as the paracentesis thoracis. At where it is done, very important. It is done at the mid axillary line. In which space? Eighth intercostal space. Don't forget this one. Yes, because it is the eighth intercostal. Because if you will do above, lung is getting damaged. If you're doing below, no pleura is there. So this is the best space. Also, there is the, yes, this space is known as costo, because here is the rib and this is a diaphragm, diaphragmatic recess. Are you getting? This is a costal, this is a diaphragmatic. So this space is known as costo-diaphragmatic recess. स्कूल टाइम में रिसेस होता था ना, खाने की छुट्टी, गैप, गैप मीन्स रिसेस. So this is the costal, it's the diaphragm. So this space is known as costo-diaphragmatic recess, where you will perform the thoracocentesis. Which intercostal space? Eighth intercostal space. Now, this is the mid, this is the mediastinum. Sir, here is the rib and this is the mediastinum. So this space is known as costo-mediastinal recess. Costo-mediastinal recess. Two recesses are there. One is costo-diaphragmatic, another is costo-mediastinal. So if fluid is here, you can remove from this portion also, this patient also. So pericardiocentesis is done through this space. We will see later. But two process, one thoracocentesis, another is a pericardiocentesis. This pericardiocentesis you will see in the clinical, and thoracocentesis, which space? Eighth, is important. Okay. Next, clinical. Pyothorax, hemothorax, pneumothorax. Pyo means pus. So pus collection in between the pleura. That is the pyo. Hemo means blood. Blood collection between two layers of the pleura. Now pneumo means air. Yes, air collection between the two layers of the pleura. Is it okay? Pleural effusion. Then pyothorax, hemothorax, pneumothorax. Everything is hidden in the name. ना नाम में छुपा बेटा, नाम को क्या करना, तोड़ना है और सोचना है. Pyo means pus. Pus in between the pleura. Hemo means blood. Hemothorax. Yes, pneumo whenever there is a pneumo means air. Pneumonia, pneumonitis. Okay. Pneumatic bone. Pneumo means air. Is it okay? And then you can see the lung portion. So when you are looking the lung, sir, right lung is in the upper lobe, middle lobe, basal lobe, left lung is upper lobe and basal lobe. In the left lung, sir, there is a cardiac notch, and there is a tongue-like position which is the lingula. Complete. Okay. So these are the differences I'm telling you here, sir. Right lung, sir, here is a liver, no? So due to liver, right lung is shorter, wider. Okay, चपटा दे रहा है, इसको प्रेस कर दे रहा है. So this is the shorter but wider. It is having the three lobe and two fissure. Can you see horizontal fissure? This is the oblique fissure. It is heavy, but left lung, sir, no liver, so it is longer and narrower. Right lung छोटा है लेकिन मोटा है. Left lung पतला है लेकिन लंबा है. Sir, here is cardiac notch in the left, and this is the lingula. Yes, so these are difference which is written here. Also, right lung is heavier, 700 grams, while the left lung is 650 grams. Is it okay, beta? Clear? Okay, sir. Same things are here. Now see, sir, this is a trachea. This is the carina. Hollywood, Bollywood, Tollywood, all eyes from the anatomy. Yes, now you are aware करीना कपूर का नाम कहाँ से आया? इसी कैरीना से आया. Are you getting? What is the degree of the carina? 70 degree. Yes, the angle between the right and left bronchus, this is the carina. How much? 70 degree. Now, right bronchus is straight, left is oblique. So the angle between the right bronchus and the midline, it is only 25, while the left is 45. Are you getting? So the foreign body is not going towards the 45 degree. It is going towards the 25 degree. So this is supplying the lung. So this is the principal bronchus. Also is the primary. Then each bronchus is divided into the three division, which will supply to the lobes of the lung. So this is the lobar bronchus. This is the lobar bronchus. Is it okay? Clear, beta? And then you will see, sir, there is a segmental bronchiole. because further this secondary will divide into the segment and it will supply the small segments of the lung, which is bronchopulmonary segment, which is the bronchopulmonary segment. So that is a tertiary bronchus, segmental bronchiole. Is it okay? But on the left side, one lobe, two lobe. So the primary bronchus is dividing the only two secondary, and then it will supply in dividing the tertiary bronchiole. Is it okay? So right lung is most common infected in the foreign body because it is only making the 25 degree. Okay, sir. Next, conducting unit of the respiratory system where there is no gases exchange, and respiratory unit where the gases exchange occurs. So where there is the no gases exchange, see, nose, pharynx, trachea, right and left bronchus, secondary bronchus, tertiary bronchus, terminal bronchiole. Up to here, no gases exchange. But now the respiratory bronchiole, the alveolar duct, the alveoli, air saccule, alveoli. Here the gases exchange occur, which is the respiratory unit. This is important for you. Important. Respiratory unit. Where the gaseous exchange occurs. Where the gaseous exchange occurs. Is it okay, everyone? Clear? Again, catch. Respiratory unit, very important. See, it is the part where gaseous exchange occurs, where the oxygen and carbon dioxide they are exchanged. In the nose, in the trachea, no gases exchange. But when it is reaching to the respiratory bronchiole, now the gases exchange, the oxygen carbon dioxide exchange starts. Now the oxygen is reaching from here into the alveolar duct, which is supplying the alveoli. Next, this complete bunch is known as the alveolar sac. One small unit of these grapes is known as the alveoli. And when you will cut it, the cavity of this alveolar sac, the cavity is known as antrum. Is it okay? Clear, everyone? Fine. So these are the 5 components of the respiratory unit where gas exchange occurs. No excuse. Read it once. पढ़ो इसको याद करो. Very important. Is it okay? Now, look here. Sir, this one. Sir, this is the alveoli. This is the alveoli. Fine. So, catch here. Sir, in the alveoli, there is one basement membrane. And here is the epithelium. Can you see this is the epithelium? So, 2 types of the epithelial cells. Type 1 pneumocyte and this is a type 2 pneumocyte. Type 1 pneumocyte, these are thin squamous epithelium. What is the function? They are responsible for the gaseous exchange. And type 2 pneumocyte, these are releasing, synthesizing the phospholipid, which is making one layer. Okay? Again, catch here. Same thing. Sir, there are the 2 types of the, very important, 2 types of the pneumocyte. Type 1 pneumocyte, type 2 pneumocyte. MCQ, type 1 pneumocyte is squamous epithelium, which will show the gaseous exchange. Type 2 pneumocyte, sir, it is cuboidal epithelium. Fine. Which will cause phospholipid secretion. MCQ. What is the name of the phospholipid? This is the biochemistry question. Very important. DPPC. You can remember the puck. Okay. Diphosphatidylcholine. Diphosphatidylcholine, na? Dipalmitylphosphatidylcholine. What is the answer? Dipalmitylphosphatidylcholine. This is your answer. Dipalmitylphosphatidylcholine. Okay. So this is your answer. Now see, this DPPC is the surfactant. So it is causing decrease in surface tension, MCQ. So it prevents the alveoli collapse. If it is absent, then alveoli will collapse together and it is known as the atelectasis. It is known as the atelectasis. Yes. Atelectasis in adult is ARDS, and this atelectasis due to the DPPC absence, it is known as hyaline membrane disease. So this is the medicine, this is the patho, and this is your pediatrics. Hyaline membrane disease important. ARDS, acute respiratory distress syndrome, important. You know, at time of the COVID, people they were getting death. Why? Due to this ARDS. Is it okay? Clear? So remember this one again. This phosphatidylcholine, they are negative charge, no? Negative will attract together or repulse together. Repulse. So due to this negative charge, they are repulsing. So this alveoli is getting deflated. It is getting inflated, you can say. But if there is no negative charge, then the alveoli will get collapse. So patient will not take breathing, and there is a happy birthday of the patient. Are you getting? So if it is not secreted in the adult, then it is ARDS. And if it is not present in the children, then it is hyaline membrane disease. Just one integration. Okay, sir. Okay. So I told you type 1, type 2. I told you about the DPPC. I told you about the IRDs and the hyaline membrane disease. Yes. Now movement of the respiration. Now we are looking for the movement of the respiration. Okay. So let's start with the another very important question, the movement of the respiration. Okay. So in quiet breathing, yes, you are sitting and you are doing breathing. Okay. Inspiration, it is active process. You are using energy. The main muscle is diaphragm, which is held by the other muscle like the extra intercostal, interintercostal. But expiration, so it is passive process. Sir, in this process, diaphragm is not acting. Diaphragm is just relaxing. It is due to the elastic recoil of the lungs and the thoracic cage. Again, muscles of the respiration. Remember, inspiratory muscle and expiratory muscle. Inspiratory muscle, main muscle is the diaphragm. No excuse. What is the root value of the diaphragm? Your formula is 3, 4, 5 keeps diaphragm alive. 3, 4, 5 keeps diaphragm alive. C3, C4, C5 is the root value of the diaphragm phrenic nerve. No excuse, very important. No diaphragm, no phrenic nerve, no life. Okay, two phrenic nerve, right phrenic nerve, left phrenic nerve. If these phrenic nerves are getting damaged, diaphragm, right diaphragm, left diaphragm, right lobe, left dome, both are getting, and patient is not able to do the breathing, respiratory failure, and there is a death. Okay. Now expiratory muscle, internal intercostal muscle, intercostal nerves. So they are causing the thoracoabdominal movement, that is the expiration. Okay. Now look, muscles of the respiration. Okay, accessory muscle and abdominal muscle. Accessory muscle, this will support, not important. Sternocleidomastoid, ischias muscle, serratus anterior, pectoris major, they will help. And also the abdominal muscle, these they are also assisting in the breathing, but not doing the breathing. Who is doing the breathing? Diaphragm. Now movement of the thoracic cage. Okay, so look here, this one, pump handle movement. Can you see this one? Sir, here is the vertebra. Here is the sternum. Okay, so you know boring, borewell. So what we are doing? We are doing up and down to the handle and the water is coming into the bucket. In the similar way, sir, this is the vertebral column. Here is the sternum and this is the rib. So this rib is doing up and down movement. Sternum is doing up and down movement. So we are doing the breathing and it is doing up, down, just like the movement of the handle pump. So this is the one question from the physiology. Handle pump movement is done by sternum. So it will increase antero-posterior diameter. Which diameter? Antero-posterior. So this is a pump handle movement. Sternum. It moves up and down. So it is similar to the pump handle. Sir, upper 2 to 6. Remember, upper, not the first, not the last. Uppers 2, 3, 4, 5, 6. They are showing. Okay. Next, bucket handle movement. You know, this is a bucket. Sir, it is a handle. So bucket handle is doing up and down movement. Is it okay? So just do imagination. Suppose this is a bucket and this is a handle. So ribs are doing up and down movement. So this up and down movement is known as the bucket handle movement. So bucket handle movement is done by the ribs. Can you tell me, it is increasing the transverse diameter or anteroposterior diameter? Transverse. Right rib, left. So up and down. So when they will do up, increase, down, decrease. So this bucket handle movement is doing the, yes, increase in the your transverse diameter. Next, look here. So diaphragm. This is the diaphragm. Diaphragm is moving up and down. So when the diaphragm is moving up, a small space. When it is doing down, large space. So it is moving up and down, just like the pistol. Just like the pistol. You know, pichkari or injection. So you are injecting. Okay, so this is moving up and down in the injection, or otherwise you can take the example of the pichkari. Are you getting? So this is what? This is the pistol movement up and down. So it will increase which diameter? Anteroposterior, transverse, or vertical? Vertical. Are you getting? Again, sternum movement, anteroposterior diameter, bucket handle movement, MCQ. Ribs movement. Yes, this was the pump handle movement, no? Pump handle. This is the bucket handle movement. Ribs, they are causing increase in transverse diameter. And diaphragm, up, down, up, down. It is pistol movement. It is increasing the vertical diameter, 3 diameter. Anteroposterior, transverse, vertical. Yes. Anteroposterior, transverse, vertical. 1, 2, 3. Simple. Okay. Next, the ventilation and the gases exchange portion. So look here. What is the ventilation and the gases exchange? Sir, oxygen is coming, carbon dioxide is going. So how much amount of the air we are taking? 6 liter per minute. 1 मिनट में कितना लीटर हम लेते हैं? 6 liter. Is it okay? Clear? And also you will see how much amount of the alveoli air is reaching into the alveoli. Answer is 4.2 liter. Yes, when it is reaching to the lung, not entire 6 liter is reaching to the alveoli. Okay, few are trapped in the trachea, few are in the bronchus. In the alveoli, only how much amount? 4.2 liter per minute. Physiology. So now this is important question. Dead space. Have you heard this dead space? सुने क्या बेटा कोई ये नाम dead space? मरा हुआ space. Dead space means it is the space which will not show any kind of the gaseous exchange. It will not show the any kind of the gaseous exchange. Is it clear? It will not show any kind of the gaseous exchange. Yes. So this is the part where no gaseous exchange takes place. Look here. Conducting part, nose to the terminal bronchiole, no gaseous exchange. So this is the dead space. While the respiratory part, where gaseous exchange occurs, the respiratory unit. Yes, sir. So catch here. No gaseous exchange, that is a dead space. So this dead space is 2 types. Anatomical and physiological. Try to understand the anatomical. एनाटॉमी मीन्स स्ट्रक्चर, जो दिखता है वो एनाटॉमी है, जो नहीं दिखता है वो फिजियोलॉजी है. The structure which is visible, that is anatomy, and which is not visible, which is doing the activity, that is the physiological. So where gaseous exchange not occurs? In the nose? No. In the nasopharynx, larynx, trachea, yes, primary nose, secondary nose, no. Up to the terminal bronchiole, no gaseous exchange. So this is the anatomical dead space. It is the anatomical dead space. What is the value of the anatomical dead space? Don't forget, 150 ml. Okay, 150 ml. Try to understand. 5 दोस्त थे, पार्टी हुई, बोले एक एक पैग मारेंगे करके. ओके, हाउ मच अमाउंट इन वन पैग? 30 ml. तो 5 पैग में कितना? 150 ml. एनी हाउ यू हैव टू रिमेंबर, 5 पैग मारना है. सो व्हाट इज द वैल्यू ऑफ द डेड स्पेस? 5 पैग्स, 5 फ्रेंड्स. नो एक्सक्यूज. डेड स्पेस, यस, द 150 ml. कितना पैग? 5 पैग. 1 पैग 30 ml. इज इट ओके? Now, sir, what is a physiological dead space? You know, physiology means function. Physiology means function. No proper functioning. No proper functioning is there. Is it okay? Clear? So catch this one. Sir, anatomical dead space. But in the alveoli, few spaces are there which are not functioning, which are diseased. भाई कुछ ऐसा alveoli होगा ना जो काम नहीं कर रहा. Like the alveoli which is not receiving the blood supply. Blood ही नहीं पहुंच रहा. Or the alveoli which is fibrosed, which is ischemic, जो dead हो गया. So anatomical dead space plus abnormal alveoli. The abnormal alveoli, they are also not showing the function. So that is known as the physiological dead space. Are you getting? What is the physiological dead space? Physiological dead space is equal to anatomical dead space plus 2 additional spaces. What? Non-functioning alveoli and alveoli which doesn't receive sufficient blood flow. Is it okay? भाई अगर ब्लड नहीं जा रहा तब भी तो उसको प्रॉपर एक्सचेंज नहीं होगा क्या? डन? Okay, sir. So remember this one. In a normal person, anatomical dead space is equal to physiological dead space, that is a 150 ml. How? Because in the normal person, all alveoli are functioning. So this is 0. And all alveoli are receiving the blood supply. So this is the 0. So yes, the physiological is equal to anatomical dead space. Is it okay? So remember this 150 ml. Now, ventilation perfusion ratio. नाम को तोड़ो और सोचो. Break the name and think about it. The zero law. Do you remember zero law? Basic law? Yes. The ventilation and the perfusion. Ratio मतलब divide कर दो. So the ventilation upon perfusion. P for perfusion. This P is also shown by the Q. So this is the V by Q. Okay? Yes. Ventilation where? In alveoli. So it is also shown in the medicine as the VA. So this is the same thing now. VP or V ए ना ऐसे लिखा है ना, छोटा सा आएगा, V बड़ा रहेगा. Are you getting? तो बेटे you will see this terminology in the medicine. Now try to understand what is the ventilation perfusion ratio. Simple. How many amount of the air is reaching into the lung? That is the ventilation. Is it okay? And how much amount of the blood, okay, is perfusing? P for perfusion. That is the ventilation perfusion ratio. अब ये समझो बेटा ये क्या चीज है? Sir, this is the alveoli and here is the blood. Suppose this is the blood. Clear? So oxygen is reaching. So this is the ventilation. But all oxygen is not reaching into the blood. Now all oxygen is not reaching into the blood. So whatever amount of the blood is, whatever the amount of the oxygen is reaching in the blood, that is a perfusion. This is the ventilation and this is the perfusion. Is it okay? Ventilation, perfusion. Okay. So what is the value? Try to understand. Suppose 100 molecule of the oxygen is reaching into the alveoli, then only 84 molecule of the oxygen is reaching into the blood. Are you getting? What is the ventilation perfusion ratio? No one is perfect in the world. No one is 100% perfect. Okay. So we have also not to be the perfect. सब चीज पढ़ना है, सब चीज करना नहीं बेटा. उतना ही पढ़ना है जो आता है उसी को बार बार करेंगे, रिवाइज करेंगे, टेस्ट देंगे. Are you getting? So this is the ventilation perfusion ratio. So remember, 100 molecule is reaching. So only the 84 molecules are reaching into the blood. So this is the ventilation, this is the perfusion. Okay. तो क्या रेशियो होगा सर? वेंटिलेशन अपॉन वेंटिलेशन 100. सर उल्टा हो गया यार, है ना, उल्टा हो गया. ventilation, perfusion. So yes, okay. So it will be the 84%. Okay, 84%. Only the 84 molecule is reaching here, na. So what you can say, sir? 84. How can you remember? 4 to the 8. So 0.84. This is the value. Okay, so this is one way how you can remember. Now come to the next. Again, same thing, ना. ये वही है, 100 मॉलिक्यूल पहुंचा है, 84 यहाँ पर. So this is the alveoli, this is the perfusion, 0.84. No, don't forget ना, for medicine and the physiology. Okay, yes. Now we are looking for the transport of the respiratory gas. We are looking for the transport of the respiratory gas. Okay, so oxygen and carbon dioxide, they are sitting in any vehicle and they are going from one side to the other side. So this is transport. Okay, catch here, sir. We will see the oxygen transport, we will see the carbon dioxide transport. So catch this one. From alveoli to the tissue, sir, this is the ventilation and this is the perfusion. But now this is the transport. From the blood, it will go from one side to the other side. That is a transport. Are you getting? This is the ventilation, here is the perfusion. But now this is the transport from one part, from the lung, it will go to the every part of the body. That is the transport. Is it okay? Clear, everybody? So we are looking the ventilation, perfusion, transport. So now catch. First, we are looking the oxygen transport from alveoli to the tissue. Two forms, as simple physical solution and in combination with the hemoglobin. So oxygen is loving to the hemoglobin. So they are making the HbO2, oxyhemoglobin. So remember, as simple solution, oxygen is dissolved in the water. Water is the best solvent in the world, you can say. So the water is dissolving the oxygen. Okay, then it is transported, very negligible, only the 3%. Water is dissolving the oxygen very, very less, that is the 3%. Due to poor solubility. Why? Because oxygen is not properly soluble in the water, so very less amount is transported. Yes, हम लोग सांस ले रहे हैं ना, ऑक्सीजन जा रहा है. So how this oxygen is transporting the other part of the tissue? Yes, by the water. Where is the water? In the plasma, in the blood. How much amount is transported? Only 3%. It is not important. नहीं सर, मेरे को याद नहीं करना, छोड़ दो. But yes, now look.